So this is a big question. Once you get started on a hair loss treatment, will you have to take it forever? Obviously, this is going to depend on several factors, but usually there are two scenarios. The first is that you've already started on some treatment or treatments and you're getting a great result. Not only did you slow down that hair loss process, maybe you also recuperated most of your hair. For these types of cases, patients probably won't ask themselves what the duration of treatment will be. They're going to want to stay on these for as long as they can. Now, there's another set of patients who only achieve mild results. This means that maybe they slow down that hair loss, but just a little bit. Maybe they grow some fuzz in some of the bald areas, but it's never enough for them to really change their hairstyle. For these patients, a hair transplant may be a better option, but that decision shouldn't be made until you've had a 6 to 10 month trial run with any of the treatments. You need to monitor your results. You need to find out which areas of your scalp did improve and which ones didn't. And it's only then that I think you can make the proper decision. Okay, and so the last scenario is that you haven't started, but you are considering some kind of treatment. If this applies to you, you really need to look at your family history. Do you come from a family of extreme baldness? I'm talking about a class 5, 6, or 7 on the Hamilton-Norwood hair loss scale. Because if so, you may be looking at some kind of treatment or treatments for the long term. You got to remember that hereditary hair loss, sometimes it doesn't stabilize naturally. It won't stop on its own until you hit about 40 or 45 years of age. So if you're only 20, you could be on some sort of treatment for 5, 10, 15, or 20 years. Now in practice, this doesn't always happen because some patients have to come off of the treatments for lifestyle reasons, or maybe because of side effects, or maybe because with time, the effect of the treatment may fade. This can happen a year or 3 years or 5 years in. And what happens is that hair loss starts to creep back. If and when this happens, you might explore other options, or you can start considering a hair transplant. Now, the best candidates for this are patients with slow progressing hair loss. What I mean is that you've lost your hair over the span of many years. It wasn't a brief 6 to 12 month period. Patients with gradual loss may be excellent candidates because not only can we fill in the bald areas, but we can also get in and between that existing and thinning hair. In other words, we can get ahead of the problem. And if your hair loss does move at a slow pace, then you might not need another procedure until maybe 5 or 10 years down the line. And finally, of course, there are those patients who want the best of both worlds. They want to hold on to their existing hair by staying on some kind of treatment. But they also want that thick density that sometimes only a hair transplant can achieve.